Hello, this is Keith, and this is a Democrat point. And I want to come straight out. I would like to run for the 9th district in Florida, congressional district in Florida. I need 7,000 signatures. I'm very new to this style of politics and building up campaigns and so on and so forth. But in the past 2 years, I've been thinking about this, but in order not to try and undermine our local leadership, I pretty much stayed to myself. I would speak at my club and so on and so forth, and I would express my feelings and positions within our local club and wherever I had the opportunity to speak at or be in a gathering. So, but now I'm more focused on actually making these moves. But like I said, this is new to me, so I'm going to need some assistance in a large way in order to just get on the ballot. 7,000 signatures to start. So that's where I am. And right now, a Democrat point, this webcast right now, pretty much is going to have to do with, I'm going to use it as a platform so I can get my views out, my positions out, what I think, what I believe, the message that I would want to carry out. And one of the first things I want to talk about is messaging, because I brought this up 2 years ago. Messaging. We have no message, right? That's what you hear all the time. Nonsense. Nonsense. What we do not have are voices. We have no voice. Our message is not being resounded. It is diluted and somewhat convoluted. It's quiet down. And I have positions on everything out there that is totally contrary to the agenda out there that wants to destroy our nation. And I have a message. And that being said, I'll give you an example. When you hear things about OBAMACARE, let's talk about Obamacare. It does not exist. Before you come up and try and explain to me what they mean, and now it does not exist. I know it doesn't exist. You know how I know it doesn't exist? Because I've looked for the bill. I've looked for the Senate bill. I've looked for the Congressional Senate bill and for the Congressional House bill, resolution bill that was passed in those two bodies of Congress. And it does not exist. There was no legislation ever signed into law called Obamacare by our president, Barack Obama. So it doesn't exist. It is fictitious. It is something that they made up and ran on. It's something that was supposed to produce 15,000 new IRS agents. It's something that's supposed to generate death squads to go and start taking old people, elderly people out of their houses and putting them in concentration camps. That's what Obamacare was supposed to do. After the Affordable Health Care law legislation was passed in both the House, the Senate, Congressional House, and the Congressional Senate, and given to the President Barack Obama, and signed into law, none of these things came to pass. None of them. Obamacare is fictitious. It's something that was made up and was allowed to be run on it because we had no message. And the message was simple. Show me the law. Show me the bills. That's a simple message. Okay. Oh, Obamacare. says it has an individual mandate to it. Hey, it's illegal. Hey, it's unconstitutional. Oh, okay. That was a Republican idea. Contrived where no other than at the House or within the Heritage Foundation over 20 years ago. You want to get rid of the Republican idea that says, not a bad idea, by the way, that says, can't have no individual mandates? Fine. Well, what about the state mandates? Well, you want to get rid of that? Get rid of it. Okay, yeah, well, okay. We keep it, we keep it. We don't. We lose it, we lose it. But you know what? That's only two parts of the Affordable Health Care Act. The Affordable Health Care Law, or legislation that was signed into law, which is now law. Two parts of it. The remaining parts, that's what I want to fight about. That's what my message is about. I got a very simple message when it comes to those parts. Well, those are Republican ideas anyway. Conservative Republican ideas. When conservatives in the Republican Party actually were not stupid. Who was it? William F. Buckley? Yeah. Jerry Falwell? When conservatives were actually intelligent. Now that being said, I'm a outspokenly humble person. We can debate that later. Anyway, like I was saying, I care about the remaining parts of healthcare. The part that says that after senior citizens pay a $200 deductible on $2,000 worth of drugs or medication, that after it goes to $2,000, that the drug companies cannot then start to charge them additional deductibles that range anywhere from 20 to 30, 40 to 50 to 60 to 80%. That's what they call the donut hole. The Affordable Health Care Law closes that, does away with that legislation that was put into place under conservatives, under the last president, when the Senate Majority Leader, Bill Frisk, was an active lobbyist, quiet, however he may have been, for the healthcare industry. That's one. That's one message I would like to hammer home. Another one, Affordable Health Care Law, says that you can no longer be dropped for pre-existing condition. A child was born with a pinhole in their heart, and this is a pre-existing condition, mind you. But it healed up within a month. Hold up. You've been paying 10 or 5, 10, 15 years. You've been paying your healthcare insurance for 5, 10, 15 years. Now something seriously happens to your child who may have dislocated their toe, broke an arm. A child got a broken arm, or a child dislocated or broke their toe. That becomes a pre-existing condition. Then they get really ill. And they got to go to the hospital. Then their healthcare provider don't want to pay because, look at this. They had a broken toe, a dislocated, broken arm, a dislocated toe. They had the measles before they came to them, before they had signed and start paying the fees that HMO was charging. This is 5, 10, 15 years people were paying into this. Anywhere from $500 up to now $1,000 a month. Huh? That's no longer allowable under the Affordable Health Care law. That was one of the things that was in the House resolution bill that passed the House, Congressional House. That was one of the things that was in the Senate bill that passed the House. That passed the Senate, passed through the United States Senate. Those were the things that were signed into law by this president, President Barack Obama. It wasn't Obamacare, affordable health care. I don't acknowledge Obamacare. Mammograms. Take a mammogram, cancer screening. Can't charge. You're gonna charge them for that? Charge them $300? Charge somebody $300? A woman $300 for pre-screening? You kidding me? No, can't do that no more with affordable health care. Can't do that. If you can't, correct me. Show me. You can no longer charge for x-rays and medical documentation from examination that has been accumulated during an examination. You can't, somebody go over here to their primary care physician and they say, okay, well, we got to do x-rays, okay? And they send you to get x-rays over here at the x-ray center. Because that's what they normally do. They don't do it in-house. They'll do x-rays in-house. Not if you're an average PC, primary care, PCP, primary care physician. No. You send them over here. So now you go over there and they see these people and they say, okay, well, here it is. And they send back the x-ray and they say, oh, this looks like an anomaly. Then they take you and you send them to to a specialist to see it. Then they do x-rays, the same x-rays, the same equipment. And then they want to charge you, bill you for that. But you could have just looked at those x-rays. It's the same equipment. You can't do that no more. Okay? Can't do that. That's what the Affordable Health Care law says you can no longer do. I don't acknowledge Obamacare. Sorry. I will not argue. Please bring, if you want to argue Obamacare, even if you are a Democrat, a liberal, a progressive, if you want to side with them and carry their argument, their message of Obamacare, this fictitious thing, then fine. Do so. But when you do so, my suggestion to you, my advice to you, if you're going to bring it to me, show me where it passed in the United States Congress, House of Representatives. Show me the bill. Show me the United States Senate bill that passed the United States Senate. Show me the legislation that was signed into law by President Barack Obama that said Obamacare. Don't tell me or try to blur the lines and say, no, they're talking about affordable health care. No, they're not. They're talking about Obamacare. It does not exist. But like I said, show it to me. And I'll be willing to debate it, argue with you. And this is some of the stuff message that I would like to put out. This is what my voice is resounding and will resound. We will continue to expound on. This is what our leadership presently lacks. It's not that we don't have a message. We do not have a voice. Our party lack true voices. We have Nancy Pelosi. We have Kathy Castor, Debbie Wasserman Schultz, Then we have the senators. We have Bill Nelson. We have Harry Reid. We have the president. But they do not get enough airtime. Every candidate should be carrying a message. And this is a message that they should be carrying. They need to be carried. And this is a message that I am going to carry. Like I said, I'm Keith. I would like to run in the 9th District of Florida, Congressional District of Florida. And I need to have 7,000 signatures, and I need assistance. I'm not gonna lie, I need assistance. This is new to me. But you know what? You can say I'm inexperienced, but you know what? After paying $1.25 million to a congressperson who chairs 2 committees and can't get anything passed through his own committees, has done nothing but vote continually against the best interests of his constituencies. And it's not just here, but it's throughout the state of Florida. Better to have an inexperienced person with a voice and the heart and the tenacity to actually go up and speak and fight for you than to have a nice guy who refuse to do their job, or have nice people who refuse to do their job, which is represent their constituency. They represent everybody's interests except for the interests of Floridians. And this is a Democrat point. And this is the point that this Democrat, or one of the many points that this Democrat wants to make clear. I am the candidate. I will be the candidate if I can get on that ballot to carry this message in this argument. One of these many arguments and messages that I feel represents the cross section, the 80% cross section of Floridians, as well as Americans in general, but more so Floridians. I'm Keith Trader, and this is a Democrat point, and I would like for you to help me get on the ballot to run for the Florida 9th Congressional District. If I take a loss of butt kicking, good. It won't be the first time I've lost. With that, thank you for taking the time, giving me the opportunity to actually express myself, and for you taking the time to actually view and listen to what I have to say. Thank you. Have a nice day. This is a Democrat point.